The day the clinic actually opened was December 1st, 2001. There needed to be a health center in South San Mateo County. And the need was very great. There were more than 112,000 low-income families living in what's considered the medically underserved area of East Palo Alto, East Menlo Park, also known as Bellhaven, and North Fair Oaks. And with funding from various organizations, principally the David Lucille Packard Foundation and Peninsula Community Foundation, and we were able to establish a 7,800 square foot modular clinic with 14 exam rooms, and next door a nonprofit resource center. And we were able to be in that location for 13 years. In 2005, Lucille Packard Children's Hospital donated a mobile clinic to the health center, which we were able to use for healthcare for the homeless services. And while most of the homeless did not come into the clinic for care, it was also to be able to take the mobile clinic out to places where they lived, encampments where they lived, and provide care directly at those locations. The mobile clinic also was used to go to the Ravenswood City School District schools to provide school exams and immunizations. At that point, the immunization rate of children in the school district was around 25%. We were very effective within 3 years to bring the vaccination rate above 90%. In 2006, we had another development. San Mateo County had operated a small 4-exam room clinic at the Onetta Harris Community Center, and their physician who was working there was looking to retire soon, and the county reached out to Ravenswood Family Health Center to see if we would be willing to continue the work at that location. We were able to add additional services, family medicine, perinatal care, pediatrics, where before the county had only had adult medicine. We stayed in that site until we opened our brand new facility in 2015 in East Palo Alto. We brought mammography services initially as mobile mammography. It was just a machine we rolled into exam rooms in our little old modular building. And then we moved to a mobile clinic with St. Joseph's Healthcare for a while. And then when we designed the new health center, we actually were able to put in a mammography suite. We were also able to add a general x-ray machine and ultrasound. Palo Alto Medical Foundation, Sutter Health does not charge our patients nor the health center for the reading of the mammograms or the ultrasounds or the x-ray, and it's a tremendous contribution. More than 70% of women who should be receiving mammograms each year are receiving them, and we were able to do the follow-up, and it's just been such a great relationship. In 2007, San Mateo County approached Ravenswood Family Health Center and asked us to develop an integrated behavioral health program. And we started providing warm handoffs from the medical provider to these therapists with the idea to do what we call solution-based counseling.
The minute they walk in, we start talking to them about different areas in their lives, their employment, their housing situation, schooling, issues at home, domestic violence. What does this person need besides this one-on-one with a clinician? So we wrap around a lot of the services for our patients, and that really impacts overall, right? If a person has a job, if a person has access to healthy food, access to employment opportunities, and on top of that, they're working with a clinician to really address, let's say, depression, coping with that and how to address them and help them with some basic interventions. It really impacts the happiness of our patients.
In April of 2010, we were able to open 10 operatory dental clinic, and we embarked on comprehensive services for all ages.
I feel that the Ravenswood Dental Clinic really provides services that the patients are looking for. We're very fortunate to be called their dental home, as we serve our patients and offer services, both restorative and rehabilitation and prevention, to patients so that they are able to maintain good overall health, that they are able to smile and have self-confidence, because that is a big piece of a person's ability to get a job in some cases, or for children to not be conscious about how their teeth look. And I think the dental clinic, most of all, prides ourselves by taking patients out of pain and giving them the ability to eat comfortably and smile comfortably.
On May 5th, 2015, Ravenswood Family Health Center opened their permanent facility at 1885 Bay Road. Because we were able to build on more than 3 acres of land, we were able to add many more services in the permanent facility than we had imagined we were going to be able to do. And so, thankfully, we were able to add optometry.
It means a lot that Ravenswood prioritizes optometry services. They understand that eye care and being able to see well and vision for our patients is an important aspect of patients' quality of life. And to stand behind an optometry department means a lot because not a lot of community health centers include optometry. And so in that way, I think that Ravenswood is pioneering and one of the few to provide such high quality and comprehensive care across many parts of our patients' lives.
We were able to add pharmacy. We continue to have integrated behavioral health. We added to our pediatrics department.
In the pediatrics, we truly believe that health is the foundation of leading a full, enjoyable, and successful life. And what I love about pediatrics is when we get to intervene early for these children, you really have an impact that is much bigger than your footprint as a department, and it lasts much longer.
And we had a whole department for women's health.
It is a great asset to have a department of women's health in this community because we're able to render a great variety of services. Some of our community members, when they become patients of our clinic, they are at awe. At the same time, this clinic is able to have a lab at the same site. We're able to offer the ultrasound that is needed right away for our pregnant patients to have their questions answered. It impacts the way that they feel. It impacts the way they're able to learn about themselves, learn about the condition that they may be going through, and to be able to care for themselves better with guidance and support.
April 1st, 2020, we embarked on a process to acquire Mayview Health Center.
I was with Mayview 2 years before we joined the Ravenswood family, and we were essentially doing the same work, working with underserved, marginalized populations, but we just didn't have a structured umbrella under which to do that provided all the different types of administrative and economic support that we needed to continue to sustainably do that. Since joining Ravenswood, I think it's only made all of our care better. Being part of a larger, more experienced, more financially solvent network allows us to be able to just focus on the medicine and not have to worry about the many other logistics that go along with delivering care, and ultimately allows us, especially as providers, to kind of be more present and human in our interactions with our patients. So I think that's been a really, really great asset and a great boon that we've been able to do more of that.
Prior to COVID, we had no experience really of doing any kind of telehealth visits. And COVID presented many challenges, not only because of the acquisition, but we had to move things outside. We had to set up screening. We had never done screening before. We had to hire staff for screening. We had to hire staff for infection control. We moved the pharmacy dispensing out to the parking lot. We started doing testing in the parking lot. We did drive-through testing until there were vaccines. And in January, when the vaccines came, we had to figure out the vaccine process. It was almost celebratory after 9 months of COVID, and to be able to provide vaccines was such a wonderful opportunity. And we're still providing community vaccines. Ravenswood Family Health Center's experience over the years has demonstrated to us that not only does it take a village, but when the going gets tough, like in COVID, and even the challenge of raising money for a multi-million-dollar facility, that our supporters, our advocates, our donors, the philanthropic community here in Silicon Valley, the community in East Palo Alto, everyone who cares about the services, cares about our mission, cares about the people we serve, people step up and they come together, and it's such a rewarding and fulfilling experience to just see people not only coming and smiling, but pitching in without even being asked. There's also tremendous hope and faith and just belief in the ability to do the impossible, to make the impossible possible. And I think Ravenswood represents that. Our 20 years is exemplary of that. And all the people who've been with us along the way, having the ability to walk with us in faith has been just a remarkable experience for myself and certainly for all of my staff and the patients we serve.